Hi, this is Daniel DiTuro. Are you considering a Medicare Advantage plan to reduce out-of-pocket expenses? In this video, I'll share what are Medicare, Medicaid, and Medicare Advantage plans, Medicare Advantage plans with Medicaid, and the advantages and disadvantages of Advantage plans. Medicare is federal health insurance for Americans age 65 or older or with permanent disabilities. Medicaid is a federal and state program that helps pay medical expenses for people with limited incomes. Both programs are administered by the U.S. government's Centers for Medicare and Medicaid Services. Medicare is funded by payroll taxes and monthly premiums deducted from Social Security payments. Unlike many countries that provide universal health care from cradle to grave, U.S. citizens must rely on private health insurance until they reach age 65 and are eligible for Medicare. Medicare coverage begins on the first day of the month you turn 65. After initial enrollment, Medicare recipients can change plans during the annual open enrollment, usually between October and December. Unlike most private health insurance that covers doctors, hospital, and drug costs under one plan, Medicare has several parts. For Original Medicare, there's Part A for hospitalization, Part B for doctors and labs, and Part D for prescription drugs. Medicare pays 80% of the approved costs for doctors, hospitals, and labs. Medicare Part B also has an annual deductible. It's $203 for 2021. That means Medicare doesn't pay covered Part B expenses until you've met the $203 deductible. For example, you see your primary care physician who bills Medicare $100. The Medicare-approved charge is $55. If you haven't met your deductible, you owe $55. If you've met your deductible, Medicare pays $44 and you pay the remaining $11. Original Medicare's provider network covers all 50 states and U.S. territories like the Virgin Islands and Puerto Rico. While many doctors and hospitals accept Medicare, some do not. With Original Medicare, if you become ill while out of state, you can visit any doctor or facility that accepts Medicare. Original Medicare covers the costs of non-emergency care at any approved provider within the U.S. In most cases, Medicare doesn't cover medical care outside of the U.S., even in an emergency. When traveling to foreign countries, you should buy travel insurance covering medical expenses. Unlike Original Medicare, Medicare Advantage plans, also known as Medicare Part C, are privately run insurance plans approved by the Centers for Medicare and Medicaid Services. About 35% of Medicare-eligible Americans are enrolled in an Advantage plan. Advantage plans spend millions of dollars annually on marketing to attract new members. Advantage plans emphasize the advantages, like saving tons of money, while numerous caveats and disclaimers are in ultra-fine print. Most Advantage plans combine Medicare Parts A, B, and D into one plan. They also offer benefits not covered by Original Medicare. Additional benefits can include routine dental exams and cleanings, vision exams and glasses or contact lenses, hearing exams and hearing aids, transportation to doctor's appointments, and fitness programs like Silver Sneakers. In many cases, monthly Advantage plan premiums equal the Medicare deduction from Social Security payments. Advantage plans offering more benefits or a more extensive provider network can charge an additional monthly premium. Advantage plans can change covered services, deductibles, coinsurance, and copays, or leave Medicare annually. During open enrollment, you can stay with your current plan, change plans, or return to original Medicare. Seniors with low incomes may qualify for a Medicare Advantage plan that includes Medicaid. Depending on income, the monthly premium for a Medicare Advantage plan with Medicaid can be zero. Ads for these Advantage plans emphasize returning your monthly premium to your Social Security payment. Medicare Advantage plans with Medicaid have the lowest out-of-pocket costs. In many cases, there are no out-of-pocket costs for most medically necessary services. Medicaid pays the 20% not covered by Medicare. Income limits for these plans varies by state. For example, to qualify in Arizona, a single adult must have income at or below 133% of the federal poverty level. That's about $1,600 per month or less. There are three major advantages to go with an Advantage plan over original Medicare. The first is choosing one plan to cover doctor, hospital, and prescription drug costs. Most Advantage plans include some form of prescription drug coverage. Like Medicare, each Advantage plan has a list of covered drugs called a formulary. And like private health insurance, formularies have tiers. The lowest out-of-pocket costs are for generic drugs. New, heavily advertised, patented drugs may not be covered. The second benefit is additional coverage for routine dental and vision expenses not covered by Medicare. Original Medicare will cover the cost of replacing teeth due to a broken jaw, but it doesn't cover routine exams, cleanings, crowns, bridges, root canals, and fillings. Original Medicare covers eye surgery to remove a cataract and replace a lens, but it doesn't cover routine eye exams to correct vision problems and detect glaucoma. The final and usually most important advantage is saving money by reducing out-of-pocket costs. As I've shared, Original Medicare pays 80% of the Medicare-approved charges after you've met your annual deductible. There's also no limit on out-of-pocket expenses with Original Medicare. If you have $100,000 in Medicare-approved charges, you're responsible for $20,000. One solution is an optional Medigap insurance plan covering all or part of the 20% not covered by Original Medicare. Unlike Original Medicare, Advantage plans limit annual out-of-pocket costs. For example, instead of 20% coinsurance, an Advantage plan can have copays for some services, but copays usually are not applied against your deductible. Advantage plans also limit annual out-of-pocket expenses, for example, $7,500 annual maximum. Instead of owing $20,000, your maximum out-of-pocket costs may be capped at $7,500. But like private insurance, there's a catch. HMO Medicare Advantage plans exclude most out-of-network expenses from annual deductibles and out-of-pocket maximums. An exception is emergency medical care. HMO Medical Advantage plans usually have the smallest network of participating providers. While Medicare Advantage plans are marketed primarily to seniors on fixed incomes with little or no savings, unless you have an Advantage plan with Medicaid, you can still have thousands of dollars in annual out-of-pocket expenses. Medicare Advantage plans love to emphasize free additional benefits. Health insurance companies are in business to make a profit. They don't provide free benefits for free. Many health insurance companies are publicly traded and must satisfy investors, stockholders, and meet Wall Street expectations. Medicare Advantage plans don't invest millions of dollars marketing their plans to lose money offering free benefits. In most cases, free means the Advantage plan offers benefits not covered by original Medicare with limitations and restrictions. The $0 prescription copay comes with a footnote. $0 doctor copay only applies to your primary care physician. There are restrictions on rides to and from your doctor. And like most plans, there's the benefits offerings may vary by plan. Some Advantage plans emphasize huge prescription drug cost savings, like our policyholders saved an average of $7,800 a year on their prescription drug costs. That's a lot of prescription drugs. Many Americans over 65 take between 5 to 15 prescription drugs daily. In many cases, the drugs are needed to reduce the risks of chronic diseases due to a lifetime of poor diet and lifestyle choices. When it comes to plans with $0 drugs, you need to consider what drugs are included. Does it apply to the drugs you take? Is it for a 30 or 90-day supply? And what are the costs of other drugs? Most chronic diseases are due to lifestyle choices, from smoking to chronic stress. In an ideal world, most people would need little or no prescription medications. Another Advantage plan claims 23% fewer hospital stays, 33% fewer emergency room visits, and more physician office tests and services. Are those good or bad statistics? Does it mean plan members are seeing their doctors on a regular basis and controlling chronic conditions? Or are plan doctors incentivized to limit hospital and emergency room admissions? Original Medicare has a simple payment formula. An annual Part B deductible, Medicare pays 80% of the cost, the insured 20%, and there are no out-of-pocket limits. Advantage plan payments varies with the plan. You may have an annual deductible, doctor, lab, hospital copays or coinsurance, lower in-network costs but higher out-of-network costs, and an out-of-pocket annual maximum. HMO Medicare Advantage plans may require primary care physician referrals to see a specialist. Advantage plans may also require prior authorizations for some services and treatment. Will a $0 primary care copay save you money? If you see specialists more often than your primary care physician, how much is the specialist copay? Specialists include allergist, cardiologist, dermatologist, hematologist, oncologist, rheumatologist, and urologist. And there's a difference between a copay and coinsurance. With coinsurance, you pay a percentage of the allowable cost versus a fixed fee for copays. Unlike original Medicare, Advantage plans have smaller provider networks. Most Advantage plans are either a HMO or PPO. HMO stands for Health Maintenance Organization. HMOs usually have the lowest cost, require you to select a primary care physician, have smaller provider networks, and in-network providers may be limited to your county or state. A HMO in-network hospital may not be the closest hospital or your preferred hospital. Except in emergencies, HMO Advantage plans only cover in-network providers. If you see or are treated by an out-of-network provider, you may be responsible for the total cost. Out-of-network providers are not required to accept the Medicare Advantage plan contracted rates for services. With an HMO plan, you're responsible for all non-emergency out-of-network expenses. And out-of-network provider fees do not apply towards your annual deductible or out-of-pocket maximum. That's not the case with PPO plans. PPO stands for Preferred Provider Organization. PPO plans can have higher out-of-pocket costs, may require an additional monthly premium, have larger provider networks, may not require selecting a PCP, or require referral to see a specialist, and covers part of your out-of-network expenses. If you're treated for a non-emergency while out-of-network, a PPO will cover part of your expenses. A HMO pays nothing. While a PPO plan covers a percentage of allowable expenses for out-of-network care, you can be billed for the difference between the amount billed and the amount insurance paid. If you have $300 in out-of-network expenses under an HMO plan, you're responsible for the $300. With a PPO plan, your insurance pays a percentage of the allowable cost. For this example, $105, but the provider can bill you for the balance of $195. Whether or not you save money with an Advantage plan depends on what type of medical care you need. Ignore Advantage plan marketing hype. Insurance company funded free helplines are designed to sell you an Advantage plan. If you sign up for an Advantage plan and find it doesn't meet your needs, you can switch plans or go back to original Medicare during the annual open enrollment period. Please leave a comment if you have any questions about this video. Thank you for watching.